Well, good morning or good afternoon, everybody, depending on your time zone. Welcome to Our Voices Still Matter, PH Advocacy during COVID-19 and beyond. I am Katie Kroner, I'm PHA's Senior Director of Advocacy and Treatment Access, and I am going to spend the next little while talking about legislative advocacy, why legislative advocacy is important right now, and how you can get involved. Before I kick off, though, I think it's really important to just start by saying that even though all of us are apart from many of our friends and loved ones right now, that we're not alone, and that PHA is here to support you through your COVID-19 experience. You'll see here on this poll from PHA's calendar, which is on our homepage, that there are many telephone support groups meeting right now, just in the next few weeks. We have national telephone support groups that anyone can join for folks with CTEPH, for caregivers, for young adults, and of course for patients coming up at the end of the month. And in addition to those national telephone support groups, many of our support group leaders have also transitioned their local or regional groups to virtual format. So there are 2 regional support groups here that have transitioned to a virtual format. Many leaders are doing that. So I really encourage you to check in with your support group leader if you're already part of a group and ask about the virtual format for your meetings, or if you're not part of a support group right now, maybe because you weren't able previously to travel to the meeting location, this could be a good time to check out a PHA support group and get connected. And then of course, PHA's patient-to-patient support line down at the bottom of the screen is always available. So if you need support, if you're feeling isolated now or at any point in the future, please reach out to PHA. In our presentation today, I'm going to spend a few minutes talking first about what advocacy even is, about what advocacy has accomplished for the PH community. I'll introduce our Together Through Advocacy campaign, and then even better, you'll have the opportunity to hear from our special guests who are here with me today, Mike Naple and Phil Goglas. At the end, we'll have a Q&A feature, and you can submit questions through the chat function. Just want to ask people to keep your questions for this webinar really focused on the webinar topic, which is legislative advocacy. I'll show my email at the end of my presentation, and if you have questions about living with pulmonary hypertension or about PH and COVID-19 generally, absolutely feel free to email those to me and I will connect you with the right person to answer them. But for this presentation, try to keep, for the interest of time, we'll just keep questions focused on legislative advocacy. So today I have really the great pleasure of introducing 2 guests to our webinar that you can see here on your screen, and they get to look at their own pictures here for a moment. Mike Naple is a communications strategist and vice president of healthcare advocacy at a boutique public affairs firm. And prior to working in public affairs consulting, Mike served on the Obama administration as a communications director at the U.S. Department of Health and Human Services. Mike's passion for storytelling and advocacy stems from his own personal experience. He was diagnosed with pulmonary hypertension in March of 2016. And Mike and I had the good fortune of crossing paths 2 years ago at PHA conference 2018, and he's been very generous in the subsequent years with his insights and advice and thoughts on advocacy, the intersection of advocacy and living with pulmonary hypertension. So I'm absolutely thrilled to have Mike joining us today to share some of his perspective. I'm also really excited to have Philip Goglas. Philip is the legislative director at the Health and Medicine Council. Phil works with nonprofit health organizations to expand research activities and educate policymakers on the needs of rare disease patient communities. Prior to joining the Health and Medicine Council, Phil worked for 2 New York members of the House of Representatives. Phil has been one of PHA's lobbyists for longer than I can keep track of at this point, Phil. He is really a pair of eyes and ears on Capitol Hill for PHA, keeping me informed so that I can lead PHA's legislative agenda, and also so that I have really up-to-date information to share with all of you about how PHA's legislative priorities are moving forward. So Phil, thanks so much for making the time today to share your perspective with us as well. So we're going to spend the next hour talking about advocacy, but what even is advocacy? I like to think of advocacy as asking people with power over a situation to use their power in a specific way. And as members of the PH community, you already know that there are lots of different ways to advocate. You are advocating for yourself or on behalf of a loved one, probably on a regular basis. Maybe you made a stop at your local firehouse and educated the EMTs about what pulmonary hypertension is and what to do in emergency. Or maybe you worked with your healthcare team to appeal a decision from your insurance company to make sure that you get the specific pulmonary hypertension therapy that you've been prescribed. So lots of different ways to be an advocate. Today, we're going to talk about advocacy at the federal level. So that means speaking out to members of Congress and to federal legislators to let them know how they can make decisions, make laws that improve life for folks with pulmonary hypertension and their loved ones. So it's been a little while since 5th grade for most of us. I'm going to start off with a very brief refresher on how the legislative process works. As we probably all know, there are 2 legislative bodies at the federal level, the United States House of Representatives and the United States Senate. And in most cases, any member of either the House or the Senate can propose a piece of legislation. They can propose a bill and say, I would like this new language to become law. But in order for that proposed bill to actually become law, it has to be reviewed and voted on and get a majority vote in the House and the Senate, and then it has to be signed by the president. And it has to do all of that in a specific 2-year period of time that's also called a Congress. So right now, we are in the 2nd year of the 116th Congress. This Congress, this 2-year period, will end at the end of 2020, and a new Congress will begin in 2021. And at that point, any proposed bills that have not become law will have to start the process over again. So why advocate? Knowing a little bit about the advocacy process helps us understand why advocacy is so important, because a bill is most likely to move forward and become law when members of Congress show support for it by becoming a co-sponsor. And they are most likely to become a co-sponsor of a bill when a constituent, an advocate just like you, asks them to do so. And to be an advocate, to be a constituent, that just means that you're a potential voter. You have the ability to vote for that individual. Doesn't matter if you voted or if you voted for them, just by the fact that you could vote for them, you are a constituent, and they're going to be very eager to hear from you about the issues that matter to you and how you think the member of Congress should act in that regard. So members of Congress are most likely to make decisions, whether it's supporting a bill or opposing a bill. They're most likely to make decisions that really benefit the pulmonary hypertension community when they have a personal relationship with someone with PH. And that may be someone that they knew beforehand that developed PH, but it may be a personal relationship that they develop with you over time as you reach out and share your personal story and ask them to speak up. So another way of saying, you know, why is advocacy important? Why is it important for folks like us to be in touch with our members of Congress? Another way of saying all of that is that advocacy matters because advocacy works. Here are just a few examples of the way that the PH community has made advocacy work for us. And I have worked at PHA for long enough that I can look backwards a good way at that, as well as look at some current examples. So again, just a few here. Between 2008 and 2010, the Centers for Disease Control invested more than $500,000 in PH awareness and medical education. In 2014, the Food and Drug Administration chose the PH community for a really unique and important one-on-one conversation where PH community members, including a lot of patients, actually came to Silver Spring, Maryland, where the FDA offices are, and had a one-on-one conversation with FDA staff about what it's like to live with pulmonary hypertension. And what's really notable about that conversation from an advocacy perspective is that there were hundreds of community groups that applied to be part of that program. FDA chose 16. And because the PH community worked together to make a good case for why FDA needed to hear from PH patients, the PH community was chosen as one of those 16 out of hundreds of applicants. More recently, the PHA has been engaged with other lung health organizations in advocating to the Center for Medicare and Medicaid Services to make home oxygen more accessible. And in 2020, during the COVID-19 crisis, CMS responded to a part of that advocacy by waiving the in-person testing and signature for delivery requirements related to home oxygen use. And then just within the last few weeks, the Food and Drug Administration made changes to the Amberset and REMS program to improve patient safety. And they made those changes based on recommendations from PHA. So these are just a few examples of the way that when we all work together, advocacy really does work for the PH community. So what can and what should Congress be doing right now? Right now, Congress is in the position to be able to take action to protect individuals with underlying health conditions, including pulmonary hypertension, during COVID-19. And they can do that in any number of ways. We're focusing right now on 4. We're asking Congress to streamline access to life-sustaining therapies. So for example, asking Congress to limit or eliminate step therapy or fail first requirements that require you to do poorly on one PH medication before you can get a more expensive medication. We're also asking Congress to eliminate surprise medical billing. Surprise medical billing, many of you may have experienced. This is when you receive care from an out-of-network facility or an out-of-network care provider. And that may be even in an emergency. It may be that you're taken by ambulance to a hospital that's out of network. Obviously, you don't have a choice at that point, but then unexpectedly after the fact, you receive a bill for the care that you received there. PHA is working with many other groups to ask Congress to end that practice. We need to ask Congress to protect access to charitable assistance. The Department of Health and Human Services has made some decisions recently that say that it's really fine if health insurance plans refuse to accept charitable assistance grants, or maybe accept the grants, but then still require that patients pay their full deductible before the grant will apply. And that's just not okay. Charitable assistance grants need to be accessible to folks. Folks who are eligible need to be able to use them. They need to have them applied to their deductible. And they also need to apply to folks out-of-pocket maximums. So we are asking Congress to get involved and take a stand on that issue, make sure that patients have access to charitable assistance. And finally, we're reminding Congress to fully fund the NIH. Congress usually thinks pretty highly of the work of the National Institutes of Health, and recently I had the good fortune to hear a presentation from the director of the National Institutes of Health, Dr. Gary Gibbons, about all the ways that NHLBI is involved in COVID-19 research. And that's important because COVID-19 impacts a lot of those body systems, the heart and the lungs and the circulatory system. And it's important for NIH to be able to continue that work and also to continue the work that they do on an ongoing basis to research and understand pulmonary hypertension. And so we want Congress to fully fund NIH so that they can continue to play an essential role during COVID-19, but also continue their important work directly in pulmonary hypertension. So the PH community needs you, and here are some ways that you can get involved. As I've been saying, you know, the PH community may not be able to storm Capitol Hill right now, but our voices really have never been more important. Congress can absolutely still hear us, and Congress works for us. It is their responsibility to take time to listen to the needs and interests of their constituents. And so to do this kind of work, you don't have to have any previous experience. Anybody can share their story with their member of Congress. There are going to be 3 ways to take action between today, which is the launch of the campaign, and June 15th. So the first thing you can do is you can go to phassociation.org/advocate, phassociation.org/advocate, and you can call or email your member of Congress right now, and that website is set up with some talking points that you can use to really easily call or send off a message. I do encourage you as you email to personalize your message, and there's a prompt that you can respond to within the message where it'll invite you to answer a couple of questions. If for some reason you can't fill it out, that's fine. The prompt will disappear and you can send the message as it is, but definitely a few extra minutes to share a little bit of your personal experience with pulmonary hypertension can make a big impact in those messages. After you've made your call or sent your visit, I hope that you'll use the form, which is the next step on that same page, to request a virtual visit. This is an opportunity to have PHA assist you with connecting online or by phone with legislative staff in your congressional offices. And virtual visits really give you an opportunity to share a little bit more of your personal story, get into a little more detail about life with pulmonary hypertension, and build that personal connection that we talked about being so important as we ask members of Congress to make decisions that really benefit the entire community. And then finally, you can spread the word. My hope is that between today and June 15th, we can bring an absolute minimum of 250 PH community voices to Capitol Hill. And you can be part of that by taking action yourself and helping to really carry the word about this campaign, share it on social media, share it with friends and family. You do not have to have a direct experience with pulmonary hypertension. You don't have to be living with PH to take action. So this can be great for your family. It can be great for your healthcare professionals. Really share it any way that you're comfortable with, and ask people to message their members of Congress as well. This is me, and I just want to remind everybody again that PHA is here to help with this process. We are absolutely here. If you're a first-time advocate and you want to practice what you want to say, I'm here to help you with that conversation. I'm here to provide resources that you can share during your virtual visit. I will be helping, if you want to do a virtual visit, I can help you set that up with the correct office. And most importantly, I can help answer not only any questions that you have, but also questions that members of Congress and their staff may have. So if you decide to do a virtual visit, really hope you do, and you come across a question in that visit that you're not able to answer, that's no big deal. Legislative staff know that that's likely to be the case, and you simply need to tell them, you know, I'm happy to get that information for you, be in touch with me, and PHA will be happy to follow up or provide the information needed to answer the question. And again, just to remind folks, I'm gonna switch here in a minute and invite Mike to share his story, and then we'll hear from Phil. We'll do Q&A at the end, and you can begin to submit questions if you have them through the chat feature, keeping them really focused on the topic today, which is legislative advocacy. And with that, Mike, I will invite you to unmute yourself and take it away.
Sounds good. Thank you, Katie, so much. Glad to be back. Worked out some technical issues that I was experiencing, but thank you again for inviting me to be a part of this. The advocacy campaign with PHA is so important, and I think you're absolutely right. Now is the time for Congress to still hear our voices, other voices, and to still be a part of the process. As Katie mentioned, I have a background in healthcare advocacy and communications. I have worked on the advocacy side, like much of you. I have also worked on the Hill. I was a communications director for a member of Congress, and you know, everything that you heard from Katie is absolutely correct. Not only do members of Congress work for you, us, and the community, but they do want to hear from you. Health policy, really all public policy is about people and the impacts that the policy decisions that our leaders are making on the Hill. Ultimately, that is about you and about us and about our families. And that is such a key thing that I think folks who aren't used to advocacy, they might not understand that or be aware of that. And when I was on the Hill as a communications director, it was my job to communicate policy, to talk about bills and pieces of legislation. And the first thing I would do anytime I was talking to one of the legislative staffers in the office, I would say, okay, you need me to get you some media attention about this. What does this have to do with real people? How are real people affected by, you know, a change in statute? And what does that mean in the real world? And that's because, you know, storytelling is so important. It's a big part of how public policy is made. It's often something that I don't think gets all the attention that it deserves, but it's a essential part. And, you know, when I was on the Hill and when we would have meetings with the member of Congress and organizations, you know, he would ask, how is this affecting somebody? Like, it's great that, you know, so-and-so association is here talking to me about it, but how is it affecting people back home in the district? And storytellers from congressional districts, they kind of have a secret power. They are very influential in the process. There wasn't a day that went by when the member of Congress that I worked for, when he would ask people, like, or excuse me, he would ask his staff, what are we hearing on this? Who has called in about this? Who has wrote about this? What are people in the district saying about this? Because that will help through the thought process and the thinking about whether or not a member of Congress is going to support a bill. And I think, I can't speak for all offices, but I do think that the vast majority of them, they're having these same kinds of conversations. They want to know, okay, who in the district cares about this? Who has a story? And again, the story, we all love a good story. Storytelling is so important. It is what compels many people to do things. And, that is a part of the public policy process that you can all have a role in. We can all vote, we can all, show up, and we can do our jury duty. The other thing that we can do as part of the civic process is get engaged with your member of Congress. And I think that Katie has laid out some really great ways for you all to do that. And communication is all about repetition, and I can't say enough how important it is for members of Congress to hear from you. Again, whether you are writing an email, whether you are making a phone call, those things are important, and they can make a real difference. 2 summers ago, a lot of folks were on Capitol Hill. They were there to, support healthcare policy. They did not want to see their health coverage taken away. And the people, the storytellers that were a part of that process were inconsequential. Not inconsequential. They were vital. They really helped inform what the Senate was doing. And something that I think is especially helpful here is that healthcare is personal. How people feel, their own health and well-being is really powerful. And I think especially in the items, the policy agenda that Katie walked through, these are real things. These are things that affect real people, and you yourself might not have PH, but as Katie said, you could be a caregiver, you could have a family member. The members of Congress still want to hear from you, and this is a perfect opportunity. Again, we might not be able to go to Congress or even go to the district office in your community, but you can still do things. I would also, for those of you that are comfortable using social media, I would encourage you to engage with your member of Congress on Twitter or on Facebook. Some offices, some elected officials use their own Twitter accounts, and they will actually respond to you. Not all, some. And it's a great avenue for folks that might already use Twitter on a regular basis. Myself, as a PH patient, I use social media quite often. And it is something that I'm comfortable with. At the same time, again, writing into your member, making those phone calls. Some people ask, like, well, how many phone calls is too many phone calls? And I think that when you are trying to create a relationship with your member of Congress, you make the phone call, you wait a while, you follow up, they want to hear from you on a regular basis. There were people, I remember in the district, there were constituents that, showed up every now and then, either in the district office or they called into the Capitol Hill office, and we got to have some relationships with them. And so, when something important was going on, they would call in. And I think that that is so important. And you can't, you can't have that relationship unless you take the action. And 250 actions in a month, that might sound like a lot, but think about it. If you did a couple phone calls, you're going to knock away at that number, and we will make sure that the voices of the PH community are heard. Something else that I wanted to mention that I think Phil will expand on a bit is the fact that you might say, well, my member of Congress is not authoring the PH bill, or they're not the lead sponsor on whatever the bill is. You know what? That does not mean that you can't approach your member of Congress and ask them to support or sign on to that piece of legislation, or to the letter, or whatever the legislative item is. Members of Congress want to hear from people in their district, the people that they represent, and you can help move them. The other thing that I wanted to mention quickly, I am a PH patient. I was diagnosed with PH in 2016. Probably I should have been diagnosed years earlier. And that's a story that I hear from a lot of people. When I was first diagnosed, I didn't know what PH was. I'd never heard of it. And it was actually through storytelling and hearing other people's experiences that I was able to kind of make sense of my own diagnosis. And it was interesting because I was diagnosed while working on the Hill. And it was just an interesting time, mostly because I thought to myself, well, I have this platform, like, how can I use it? How can I bring more attention to pulmonary hypertension? Folks in the community often encourage people to ask, well, it could be PH. And I think that is, that kind of streamlines with the idea that, members of Congress, they might not know about pulmonary hypertension. Not all of them are champions yet. And it's probably because they haven't been asked. Not that they don't care, or not that there's not somebody in their community that has a connection to the PH community. And, the way that you bring them in the know is through advocacy and through talking to them about it. Since my diagnosis, I think part of the reason that I hammer home the importance of storytelling is because I've seen its power kind of in a new way, as I have become a storyteller myself. And, I am just one person in the PH community. And I just want to reiterate that we all have a story to tell. We all have something to say, something to contribute. And, again, what I love about what the PH Association is doing is that they're giving folks many options for how to weigh in. Not everyone is comfortable over the phone. If that's you, that's okay. You can still tell your story, write it out, send that email, have somebody call on your behalf. There are things that you can do. And if I was going to leave you with one last thought, it really would be to, ask yourself, what can you do, and what is my story? Because you do have a story. It's incredibly important, and I hope that many of you will use some of the tools that Katie talked about. I know that I'll be making a call or two myself. And with that, I will turn it back over to Katie.
Thanks so much, Mike. I really appreciate it. I'm going to go bop right over to Phil and let him share a little bit of his perspective, his lobbying experience, and thoughts on, again, the importance of individuals sharing their stories, just as Mike has said, and the ways that can really make a difference in Capitol Hill and the different avenues that are open to you to do that. So Phil, thanks again for being here, and take it away.
Thanks, Katie, and thank you, Mike. I think both of you hit on a number of important areas for our community to understand how they can get involved and really make a difference, not only on their behalf, but on behalf of the entire PH community. So the first thing I just wanted to start off with, I know some folks may have this question of, while the COVID-19 pandemic is happening and while it's going on, is it an appropriate time to engage with Congress on other issues? Is it appropriate to still ask them to support issues that aren't directly related to the COVID-19 pandemic? And the answer to that is absolutely. Every day I'm here in Washington, I'm on countless conference calls or webinars with congressional offices. They are still working through their normal legislative process in spite of responding to the COVID-19 pandemic. Just this morning, I was on with a Senate office talking about appropriations, and I've had similar conversations over the past few weeks, as well as discussing advancing critical pieces of legislation when Congress returns to some sense of normalcy. So we do recognize everything that's currently going on and what Congress is focusing on, but they still are working very hard on other issues that aren't COVID-19 related and other areas of federal policy. And we've seen that staffers have been incredibly flexible. Offices have been receptive to hearing from individuals. A number of organizations that I work with, we normally have in-person Hill days here in Washington, and all of those have been postponed and have moved to a virtual component. So a lot of patients in the rare disease community have been reaching out to their members of Congress, have been contacting their local office and sharing their story and their request with them, contacting their DC office and making the same request. So I very strongly encourage everybody who is participating today and who's watching to definitely go to PHA's website, get all the information. As Katie mentioned, we worked on a script that everybody will have, and whatever you're most comfortable with, whether it's making that phone call, sending an email, we encourage you to reach out to your local office, develop those relationships. You know, grassroots advocacy really makes my job a lot easier. I could go into every congressional office and sit with them for an hour and talk about the importance of supporting PH priorities and working on behalf of the PH community. Katie could tell you countless number of meetings that we've been in over the years, and we've talked about funding for federal programs or co-sponsoring and passing a specific bill that would benefit the community. And the one thing that the staffer or member asks for is, what does my constituency say about this? Who lives in my district or my state that is supportive of this? And that's where it's critical that we have all of you share your voice and contact your members, because they enjoy and they're thankful for hearing the information from Katie and myself. But what really drives it home is hearing from a constituent. We have, through our grassroots advocacy over the years, have developed numerous champions for the PH community that have served in Congress, that continue to serve in Congress. A few that come to mind are Kevin Brady, who is a Republican member from Texas. He is a former chair of the Ways and Means Committee, which is the chief tax writing committee in the House of Representatives. And he became a champion of the PH community because of a personal connection he had, where a good friend of his from his district in Texas, his daughter had pulmonary hypertension. So because of that personal connection and that advocacy of Kevin Brady's friend, who spoke to him about the importance of supporting PH, made that personal connection for him. Over the years, Kevin Brady has never once said no to the PH community, whether that be being a lead Republican on any PH specific bills, recognizing Awareness Month for pulmonary hypertension. And really, anytime we contact his office and say, can we count on you for this? The answer is always absolutely yes. Following the same thought process or the same line, you know, Congressman Jamie Raskin from Maryland, who is a Democrat, and he is a liberal Democrat, not really on the same page as Kevin Brady on a number of issues. But the one thing they will always agree on is supporting the PH community. And Congressman Raskin not only represents the Pulmonary Hypertension Association headquarters, but also represents a significant amount of PH patients and community members. And many of our community members have met with his staff and himself personally, not only here in DC, but locally in Maryland, and have developed that relationship with him personally. Our last Large Hill activity last year, we invited him to join and address the participants of our PHPN Day when Congress wasn't in session, so he did not have to be in Washington, but he made it a point to be there and to speak with our participants and with us, and tell us about the importance of what we were doing and how he will continue to support the PH community. Senator Casey, another Democrat from Pennsylvania, is a big supporter of the PH community because of that personal connection. And going back to something that Mike said, even if you don't have a member who is an appropriator who decides how much funding NIH gets, or if you're not, your member is not a member of the Ways and Means or Energy and Commerce Committee, so they don't have any jurisdiction over step therapy, or if the senator is not on a relevant committee, it doesn't take away any of their support and value for our community. The more members that ask for a specific priority, the more likely it is to pass. So if we have 250 new offices from this campaign that we have never contacted before, that's now 250 new offices who have heard about pulmonary hypertension, who have received an education on PH, and who we can continue to work with to ensure that they continue to be supportive of the PH priorities and our community. Again, you know, we are in a good time to advocate with members of Congress. They do work for you. We are in an election year. They're more available now, especially during COVID-19, because they can't be out there shaking hands. They can't do a number of things that they normally do in election years in terms of meeting with their constituencies and potential voters. So as Mike mentioned with social media, you know, again, I want to reinforce that, encourage you to follow your member on Twitter, on Facebook. A lot of members are doing virtual town halls where they have the member who's available, whether it be webinar or another venue, and they're asking questions of their constituents and providing information to them. And just because you have one contact with them now, you continue to discuss priorities with them, you reach out to them, you develop those relationships. And, you know, our goal is to have you, through continuous outreach with your office, get to that level. There are countless PH advocates that every time they come into DC, we stop in to see their members, and we don't have to spend, you know, 15 minutes talking about why PH is important. The staffer says, whatever you guys need, we absolutely will do. I just wanted to check in with you and see how you're doing personally. How are your treatments? Are you facing any issues? Is there anything that's come up that we should be aware about for the PH community? But as soon as they hear that a Diane Ramirez from the board is in town, you know, they always want to see her to get an update on what she's doing. Colleen from Connecticut, you know, how's she doing and how can we be helpful? And that really is a testament to the importance of grassroots advocacy. So again, there are plenty of resources for anybody who would like to participate. Katie is a great resource, and Katie and I have worked very closely together on any number of things. So if you do have a question, please don't hesitate to reach out to Katie. If you have your virtual visit or your interaction with your member office and they have a specific question that you don't know, don't be afraid to say, I'm not sure, but I can get that answer for you. And then that gives us an opportunity to follow up with them, write down notes about how your meeting went, who did you speak to, what comments or questions did they have, and is there something that they wanted more information on, or did they say, I want to be more helpful, let me know how. That's good information to share with Katie, so that way we can work here in Washington to get those questions answered and continue developing those key relationships. With that, Katie, I'm going to turn it back over to you to open up for enough time for Q&A.
Thanks so much, Phil. That's great advice and encouragement for everybody that we have listening on the phone today. I, at this point, don't have any questions. I'm going to remind folks that if you do have questions, you know, we're available here for about 15 more minutes. There are 2 ways that you can share those questions with us. You should see a chat function on your webinar screen. You can choose who you want to chat with, choose chatting with the panelists, and then just type in your question and I'll see it and I can read it aloud to folks. If you're struggling to find your chat, but you are sitting in front of your computer, you're welcome to just email me directly. You can email advocacy@phassociation.org and that'll come, and I'll take a quick glance at my email here in a moment. While we wait for folks to see if they have any questions, I think I'll just reinforce something that Phil was saying about the personal relationships that the PH community has built with various members of Congress. And that's that, in some situations, hearing the same message multiple times is important to a congressional office. So when we're talking about a high profile, hotly debated issue like healthcare reform, volume does matter. When it comes to the things that the pulmonary hypertension community are asking for and building those relationships, many times just one visit or just one constituent asking for a member of Congress to do something is all it takes. There have been many situations in the past where one constituent has gone into a member of Congress who was totally unfamiliar with pulmonary hypertension, and they have educated them about pulmonary hypertension and shared a personal story. And by the next day, the member of Congress had co-sponsored the legislation that the constituent had come in and asked about. So really, just one voice absolutely does make a difference. And when you think about your voice as an individual multiplied by 100, 250, 500, 1,000 members of the PH community making these asks together, we really are going to have a tremendous impact now during COVID-19 and for the future of how pulmonary hypertension is treated in Congress and treated by the law. So I really encourage you to get out and share your story, even if this is new to you. It really does make a big difference. And
Katie, if I could just add to that, I remember back in 2017, brand new Congress, a lot of new members. Sorry, it might have been 2019. It was one of the past few Congresses that they all get blended after a while. But PHA, we were very active as usual on the Hill, and we had a PH-specific letter that was being circulated by Congressman Kevin Brady and Congressman Jamie Raskin. And we had an advocate reach out to us and said, I have this great relationship with my new member from Indiana, and it's nobody that Katie or I would have thought to go talk about PH with, because this member wasn't on a key committee, was a freshman member, so doesn't really have some of the clout as other members do. But we went into that office, and as soon as we mentioned the advocate's name, the chief of staff said, absolutely, my boss wants to be as helpful as possible. And I think a half hour or an hour after we left that office, we got an email from the chief of staff saying, we reached out to Raskin and Brady and asked for our boss to be added to the letter. And please keep us informed of everything that's going on as you continue to work this process, so we can be as helpful as possible. And that was just a 15-minute meeting that was building off of a conversation that a local advocate had with their member's office and with their member. And for somebody who was new to Congress and really didn't have that full PHA presentation, was willing to lend his name to supporting our community.
I think so. Yeah, that's a great example of exactly that. Maybe the other thing I'll add, I'm still not seeing questions, which is totally fine. I'll take that to mean we covered all the most important information and everybody's ready to go. Won't hold everybody right up until 2 o'clock. But I guess the other thing I'll note is that folks on the call may or may not know that members of Congress, most members of Congress have multiple offices. They have an office here in Washington, D.C., where they have staff that work on a variety of issues, including an assigned healthcare staff person. And then they also have staff back in their home state in their district office who work to really assist constituents one-on-one with concerns that they may have, as well as taking those local visits. And by getting involved in this sort of two-step campaign where you get to send an email that'll go to the Washington staff and then also potentially make a virtual visit with local staff, you really have the opportunity to carry your message as an advocate to both offices. And Phil, I think you were even noting when we spoke earlier that some members of Congress, when they do virtual visits, are bringing staff from both of those offices together for the same conversation, which is something that's the smallest of silver linings, something that might not have happened prior to COVID-19.
Right, and we definitely have seen that because we are in a new excuse me, virtual world, so to speak, in terms of meetings and these kinds of activities. There have been a number of offices that I've been in contact with where we've scheduled a meeting with the DC-based staffer, but the state-based staffer has been on as well. And a lot of offices are having, you know, two key members of the health team of an office, one in the district, one here in DC, to be on the phone or the Zoom or any, you know, webinar platform. So that way everybody is on the same page of what's going on and hearing the request. And it also provides our advocates with a good opportunity to develop the relationship, not only with the local office, but with the DC office as well. Because when you meet with a local office, let's say you met with Katie in Florida, Katie would take all of the information, would meet with you, would discuss the priorities with you. She would then, at the end of the week or whatever that specific office policy was, would send Mike an email who works on healthcare in DC and say, Mike, I met with Phil this week from the Pulmonary Hypertension Association. He's a PH advocate. These are the things we spoke about. But what we've seen now is Katie, Mike, both would be on for me to share with them my story and to close that loop with them. And then I would have both of their contact information and can follow up with them about key things. Mike in DC, if I see there's a bill that's coming up, or just to keep him in the loop on things that are happening. Katie locally, to invite her to a support group meeting to meet other PH advocates and the PH community, to work with her to maybe get the member to come to an event or to schedule a meeting with the member themselves. So we definitely have seen where you now have the opportunity to meet with both local and DC staff at the same time and develop those key relationships.
Thanks, Phil.
Hey, Katie, can I just hop in there really quickly?
Yes, please.
Something that I don't want to discount is something that Phil said. And, you know, we talk a lot about how do you cultivate a relationship with a member of Congress. And one of the strongest ways to actually do that is to cultivate a very strong relationship with a staffer. You sometimes, you know, when you're doing a advocacy visit or you do a phone call, you're not going to talk to the member the first time. It's often that you will talk to a staffer, and a staffer is, you know, can be your best friend. And that is so key to creating kind of a larger relationship with the member of Congress and their office. So don't be, I was talking to somebody the other day that was a little discouraged that they only got to talk to a staffer. And I was like, absolutely, that's still a valuable interaction. You did not like fail in your advocacy because you only spoke to a staffer. They are, you know, kind of like the whisperer that can help move along whatever it is you're talking to the staffer about. And certainly if the member is not aware of what PH is, you sure want to make sure that the staffer understands what PH is, why you were calling. That is kind of like your first line of defense.
And if
that's a great point, Mike.
If I could just add to that, Mike, just two quick things. When I was a staffer, people would come directly to me, and I'm sure they did when you were a staffer too, Mike, because they knew, staffers are those whisperers, and a member has to deal with any number of issues. But when you're talking with a health staffer, they are an expert in health policy. They're the ones who their bosses will look to and say, we're talking about health. What do you know about it? The member relies on their staff heavily, who are experts in different fields, to provide them with the best advice possible and share that information with them. And I think it's safe to say Katie and I know if we want Jamie Raskin or Kevin Brady or Bob Casey to do something, we know exactly who to talk to in their office to get it done. We don't talk to Kevin Brady directly, but we go right to the staffer. We know that if we just reach out once, she'll get it done. So that's a good point for people not to think that talking to a staffer is not as useful as talking to a member. Sometimes it's even more useful for you to speak to a staffer because they're the expert and they're the ones who will raise an issue to their boss and say, this is something you should support, and will really be that advocate for you in that office.
Yep, that is 100% correct.
So we are 4 minutes before the hour, but Mike, Phil, do either of you have a final point that you would like to make before we wrap up the presentation? Anything you forgot to say? It's been burning a hole in your brain.
No, I'm glad that folks hopped on to this call and had the chance to hear what we had to say. I'm hoping that it gives you all a little bit of confidence to take action. Again, there are multiple ways, and sometimes you've written an email and that is your first action, and then that'll also give you the confidence to next time to pick up the phone, or to visit a district office once it is safe to. I think right now is a great time to be cultivating relationships with staff and members of Congress, so that when we do return to a time when you can, visit the Hill or visit the office, they will already know who you are. You will already have created that relationship. So thank you for your advocacy and your enthusiasm.
And I just want to say thank you for everybody participating and taking action. It really does, from my perspective on the government relations and policy side, it really is something that makes my job easier to go into an office. And they tell me, I heard from 15, 20 of my constituents about this. I'm very familiar with this because of the outreach that I've had from my community and from my constituents. And it also allows us to continue to grow that base that we work with, Katie and I here. And I think what Mike just said is critically important to remember too. A lot of what we're doing now is planting the seeds and laying the groundwork for when Congress gets back to some sense of normalcy and we are able to have in-person meetings again or continue our in-person advocacy, that we have been continuing to work, and we haven't taken a pause with COVID-19, but we've been very active in ensuring that Congress continues to receive an education on pH, and we continue to let them know that we need them to continue to be supportive of us and our community.
Perfect closing words. Thank you so much again, Phil, for your time, and Mike for your time today in the middle of the workday. Both of you, I know, but really appreciate you having you here and all of your insights and perspectives. As a PH advocate and both as former staffers, I think it's really great to get that inside scoop of what life is like when you're a staff person on Capitol Hill receiving these messages and these visits. So thank you again for that. And thank you to all of our participants today. Again, don't hesitate to reach out. Just because we've reached 2 o'clock doesn't mean that I'm not available, Phil's not available. Definitely reach out. You can reach me at advocacy@phassociation.org. I'll look forward to hearing from you. Take care, everybody.